And let's make sure that I clicked it. All right. So we are recording, and I am going to screen share. Um, Raj, my one of my student assistants, and Brittany, one of my suicide prevention student board members, are going to be watching the chat too, guys. But Raj and Brittany, if you notice my audio go off, just hop on and let me know, just because I may not be able to recognize that my audio has been acting up. So let's go ahead and get started. Let me click the right screen share here. Click. Woo. All right, small victories. Here we go. Okay, guys, so let me click that. Not save. There we go. Whew. All right. So my contact info is here if you ever need to get a hold of me, got questions. Also my website, I call it my website, but it's the Suicide Prevention Wayne State website. We update this with trainings that we have going on. We do have a training coming up next Friday, not this Friday, but the Friday after. We are test driving virtual mental health first aid. If you're interested in being trained more about mental health and recognizing mental health concerns, we do have some spots available left. We will begin offering this more often during the summer now. But what we're going to be talking about today is mental health and talking about suicide prevention. So I want you guys to think about just mental health. Now, when we're talking about mental health, we're going to try our best to practice neutral language. We're going to mess up when we talk about it, and that's totally fine. The important thing is that we keep trying to do better. What we know about mental health is that majority of people with a mental health concern don't really get the help they need. And that's not for one reason or another. Just like with mental health, it's never just one thing. But some of the common concerns that come up is that there's still a lot of stigma attached to mental health. Sometimes people don't know about mental health, or maybe they're not aware of resources, or resources are just expensive. Now, I will be providing Wayne State mental health resource information, but also some community resources too for free counseling, as well as helplines if anyone just needs to talk to somebody. But, sometimes we don't know how to respond if someone's having a mental health concern. It can be uncomfortable. It can be awkward. And that's okay. If it was comfortable, we wouldn't be having this conversation. But even though it can feel uncomfortable, we just want to let people know that mental health concerns are fairly common. And it's common to have more than one mental health concern. And especially now with everything that's going on, we may feel our mental health is being affected, just our everyday stress. And what we know when it comes to mental health now is that we're focusing a little bit more on depression, anxiety, and what get back up there. Depression and anxiety are our two most common mental health concerns in this country. They're the most common mental health concerns amongst university students as well. And the reason I put feeling versus disorder is that there is a difference. I'm sure that we've all felt depressed. But the feeling depressed is different than having a depressive disorder. A disorder, we're looking at something that is ongoing, that someone just can't shake, and has been going on for a while. And that's the same with anxiety. These are feelings. Feelings are okay. Sometimes we associate some feelings as bad and some feelings as good. And a feeling is a feeling. And anxiety, can actually be good for us sometimes. It can push us to change. But sometimes when we're experiencing more anxiety than what we're used to, or it's anxiety that keeps coming back, or it's negatively affecting us in other areas of our lives, that might be sign that a potential mental health concern or a disorder is there. Now, the other ones I have here: loneliness, grief, anger, and isolation. these are mental health concerns that, with everything that's been going on, pandemic, racial injustice, social injustice, um, we may be experiencing these more than we're used to right now, and same with people we care about. Loneliness doesn't necessarily mean physical loneliness as well. It could just feeling like you're not connected with people anymore. Grief can be people dying, grieving people we've lost, but also grieving loss of, our plans for the summer, what we had hoped to get done. And certainly these can bring up feelings of anger, being angry about everything that's going on, and isolation. And again, just like with loneliness, this doesn't necessarily mean somebody who's isolated from others physically, but they feel like they're isolated from others. And with these four and other mental health concerns and feelings as well, but with more focus on these four, sometimes when we're stuck in a place like this, there can be what's called tunnel vision, where someone may not see all the resources and support that are out there for them. And we're going to talk more about this in regards to suicide prevention, about that tunnel vision. Um, Now, if someone's dealing with mental health concern, that doesn't mean there's a suicide risk. But certainly with how people are doing right now, we do think about suicide risks, just because things can be really stressful for people right now. Now, the main focus of this is going to be on suicide prevention. Suicide is a very uncomfortable topic, and that's okay. It may create feelings of uneasiness in us because that's what it's supposed to do. Suicide goes against everything that we're really striving to be, doing better, moving forward. Um, and think about that uncomfortable feeling you may be having right now. Imagine how somebody who's going through something or suicidal thoughts right now can feel. So, part of what we're going to go over today is to familiarize ourselves with some risks and what to do when we're concerned about somebody, but also to become a little bit more comfortable talking about suicide. And the reason for that is because suicide is a major health issue in this country. It's a health issue around the world, but it's actually globally, suicide numbers have gone down. In the United States, they go up every year. It is a major health concern in the United States. It's still the 10th leading cause of death in this country. And it's something that, funding wise, money wise, that we've spent on this health concern, it's been fairly consistent over the years, even though our suicide numbers continue to go up. Over 40,000 people, it's actually pushing over 50,000 people die from suicide each year in this country. Now, notice when we're talking about suicide, it's die from suicide, death by suicide, or somebody completed suicide. We want to try to avoid saying committed suicide. The reason for that is that that may have a negative tone to it. It makes it sound like somebody has done something wrong. And there's enough stigma already with mental health, and with suicide, we're dealing with more stigma, and as well as guilt and shame that may come up. So we really want to try our wording, and you're going to mess up, and that's okay. I have attended presentations with other mental health professionals, and I've heard them use some terms that, I don't necessarily agree with. So, we're all trying to do better with how we talk about mental health and trying to avoid some of these negative words. The same goes with completed suicide versus successfully completed suicide. Why is the success thrown in front of it? We don't need to label anything on it. It's already a serious enough issue as it is. And just something to keep in mind when it comes to data on mental health. We estimate over 1 million suicide attempts a year. Even with what we've listed as people dying by suicide, these are based on death certificates. So anytime you read data on mental health, remember that that data is limited. When we're talking about just mental health in general, most of that data is coming from people in treatment. And remember, less than half of people with a mental health concern are actually getting the treatment they need. And with suicides, we're basing it off of death certificates. So we are missing data too amongst that. It's a serious issue. That's why we're talking about it. And we're trying to get a little bit more comfortable. And you being here today for this webinar shows that you care enough to try your best to become more comfortable with this topic so that you can help look out for each other. During these stressful times, I'm not even going to say the new normal because things aren't normal. Things aren't going to be normal for a while, and they may never be what we were used to. And that's not good or bad. That's just where we're at right now. So I've broken it down into things that we can do. And this is a small section of what we do with mental health first aid. But for what we're talking about today, this is really what we're going to focus on. We're going to focus on assessment and then listening, giving some reassurance to somebody, some information, and then encouraging help. And you know, what we're talking about today, you don't need to be a mental health professional to do. We don't want you to feel like you have to be a mental health professional or be somebody's therapist, though I'm sure we do have people in our lives who we kind of act as a therapist for, and that's okay. But we're going to talk about how we can do this in each of our respected roles. So if you guys feel comfortable in the chat, let us know. Are you student, faculty and staff, community member? Just let us know, because we're going to cover, you know, what we can each do within our roles here at Wayne State or outside of Wayne State. But again, you don't have to be a mental health professional to do what we're talking about today. So when we talk about suicide risks, and we're talking about assessment, I'm not talking about, you know, taking out a sheet of paper, asking questions, interviewing somebody, taking an intake history. When we're talking about suicide risk assessment, we're going to talk about some things that through research and what we know may put an individual at higher risk for suicide. These risks do not mean that someone's going to attempt suicide, think about suicide, or die by suicide. But these are things that we know could put an individual at higher risk. And we're going to talk about a few of these. There we go. Now, when we talk about gender, what we're talking about is in this country, more women attempt suicide, but more men die by it. And there's numerous reasons. And the thing with mental health is that there's never one reason. We usually base things on correlational data. We can't really say cause and effect. But what we do know is that more women attempt 3 to 4 times more than men. But more men die by suicide. And our information, our data about the LGBTQ community, our trans community, is at higher risk as well. LGBTQ community in general is at higher risk, and that's not because of someone having a different sexual orientation or gender identity. It's everything, unfortunately, negative that can come from that in our society: lack of support, isolation. This is what puts an individual more at risk, not necessarily somebody identifying as a different gender or a different sexual orientation. When we talk about age, and the thing with, you know, suicide does not discriminate when it comes to, you know, and mental health in general does not discriminate. But when we're looking at age, it's actually still our older adult population is still the highest at risk for suicide. However, our young adult population, university student population, and unfortunately children and teenage population are also at high risk. Suicide is the second leading cause of death in this country from children through young adults. And it used to be the third leading cause of death. So it has gone up. However, for highest risk, highest age group, we're still looking at our older adult population, 60 plus, are still our highest at risk. And for our other risk factors, we want to think about somebody's quality of life. if someone's constantly in physical pain, or maybe someone's dealing with a mental health concern or a mental illness, that can certainly put somebody at risk. Now, notice throughout right now, just talking about mental health, I have yet to say mental health problem. Because I don't know about you guys, but when I hear the word problem, that has a negative spin to it. It's something wrong. And we talk about stigma with mental health, but there's still a lot of guilt and shame when it comes to mental health. Some people may feel it's a personality flaw or a characteristic flaw. And if I say someone has a problem, that makes it seem like they've done something wrong, which is why I tend to use the word concern. It's a mental health concern. I feel concerned for somebody. But that's just part of trying to use neutral language when talking about mental health, because we never know 100% what someone's gone to or how they're going to respond. And even if you do mess up in talking about mental health or suicide, you are never responsible for somebody's mental health. We are not that powerful. Even when others blame us for their mental health, you are never the sole reason why somebody's mental health declines. It's never just one thing. You may do everything right when we're dealing with, trying to prevent a suicide. And unfortunately, someone may still die by suicide. That does not mean you've done something wrong. We do the best we can with what we know in the moment. When we're looking at these other risks, alcohol or substances, any substance use increases the risk. Substances are something that usually comes up when I'm working with clients as a coping strategy. Substances may initially work to help somebody cope with what they have going on. They initially work because they suppress feelings. It doesn't make the feelings go away. They're going to come right back because the underlying concern's not being addressed. But any sort of substance use, misuse, abuse, intoxication, and withdrawal can put somebody at risk. Substances suppress feelings, but they also decrease impulse control. And when we're dealing with suicide risk, that is a risk if someone's impulse control changes. And we're going to talk a little bit later about the difference between a suicide attempt, a plan, but also suicidal ideation. That impulse control is a risk because someone may have a thought about suicide, but no intent to act on it. But substances can affect that motivation and intent to act on a thought. If we think of less social support, that can certainly be a risk. If someone does feel like they're alone, they feel like they're isolated, nobody notices them, nobody cares enough about them. And that's tricky now. Even though things are opening up again, that doesn't mean they're going to stay open. But even with things opening up again, we're not seeing people as much as we used to. And that can certainly make it hard, to see how somebody's doing if all we're going on is what somebody's posting online or showing. Something as simple as just a check-in with somebody to see how they're doing can let somebody know that you care enough to check in on them. I was surprised. I had a few friends check in on me. And I'm like, look at that. And then, I went and checked in on some people that I know. But just a simple message, check-in, seeing how somebody is doing, that will let somebody know that there are people who care about them, that want them to be here. And then our other two risks that I've listed on here, previous attempt and organized plan. Now, a previous attempt, if someone discloses they've attempted suicide before, that does not mean 100% they're going to attempt again, but it's still a fairly high risk factor. What distinguishes it from a higher risk factor and a lower risk factor is how much time has passed. If someone discloses to you they attempted suicide 2 weeks ago, compared to someone who disclosed that they attempted 2 years ago, these are both risk factors. We want to know what was going on. But the person who attempted 2 weeks ago, that's the higher risk because it's still there. And, with previous attempts, I've worked with clients who've attempted suicide. Remember, neutral language when we're talking about suicide attempts. Sometimes we hear people say, or even we read about it, that somebody unsuccessfully attempted suicide. And again, we don't need to throw any labels onto it. It's already a deep enough and uncomfortable topic as it is. We don't need to add anything more to it. Organized plan is a risk. However, if we're with somebody and they tell us they have a plan for suicide, we're past risk factors. We want to keep somebody safe the best we can within our own unique roles, what we feel comfortable doing. Now, there is another risk factor that I don't have listed. And the reason for that is that this risk factor with recent research has moved its way up. It's something that we normally didn't talk about as a risk factor. We had it in its own separate category. But self-harm is another higher risk factor. There is a difference, though, between self-harm and a suicide attempt. They're both uncomfortable topics. We don't want people hurting themselves or wanting to hurt themselves. But self-harm is something somebody does to cause harm to themselves. But the intent is not to kill oneself. The intent is just to cause harm. And that's not to minimize it. But in keeping somebody safe and keeping somebody alive, there is a distinction between it. And I know this is an uncomfortable topic to talk about. But self-harm is still a fairly high risk. And again, with us being more so remote now, signs of self-harm can be hard to recognize. Because like right now, I'm seeing clients remotely through Microsoft Teams, is why I'm using it for this webinar. So I continue to practice it. But it's hard to recognize signs of self-harm through a screen. It can be hard to connect with people through a screen. We do the best we can. And, you know, right now it could very well be just checking in on people, seeing how they're doing, letting people you know that you care about, that, you know, if they need to talk to somebody, reach out to you. You're there to listen to them for a bit, letting them know about resources. So with these risk factors we have up here, this doesn't mean that somebody is going to die by suicide or attempt suicide, but we know that these may put somebody at a higher elevated risk, maybe compared to others. And another one's not even on here if we think about everything that's going on right now with the pandemic, our financial stress, financial concerns, maybe somebody losing their job, somebody losing their home. Certainly a big stress right now is people wondering, are they going to get evicted from their homes? So there are a lot of stressors out there right now that have always been there, but are elevated now with everything that's going on. And all of these are risk factors for suicide or other mental health concerns. And your guys' roles, you know, you guys aren't all mental health professionals, but somebody is more likely to come talk to you about a mental health concern than thinking about going to a counselor. Mental health, healthcare professionals, you know, there's a greater need now for counselors, but usually people are more likely to go to friends, family, people they know, or a doctor or somebody in the medical field to talk about mental health before thinking of coming to a counselor. So you guys are kind of our first responders in regards to mental health concerns, because someone may disclose to you that they're having a hard time, and then you can have that conversation with somebody to encourage them to seek out counseling. And that's why we're also going to provide free counseling information as well, because, you know, sometimes people can't afford counseling or don't know of resources near them. Some additional risk factors. And what we want to think about, you know, when it comes to suicide or thoughts about suicide, is that a person doesn't want to die. Someone just doesn't know how else to manage the pain that they're in the moment. And that can be hard for us to imagine if we haven't been there before. But we certainly can try to understand what could be going on in somebody's life. For someone, maybe the loss or a breakup of a relationship or a friendship, that may be something where someone feels they don't know how to handle that distress and pain anymore. So think about when we're talking risk factors, we're talking about somebody's quality of life. And all these risk factors we're talking about certainly affect somebody's ability to enjoy their life. to do what they need to do during the day. Um, a suicide of a friend or a family member is also a fairly high risk factor. And the reason for that isn't because of a copycat syndrome or anything like that, but it puts suicide there. If somebody close to us dies by suicide, we're at higher risk for it just because we're closer to it. It's something that may affect us a little bit more personally than, say, somebody else dying by suicide. So there's a difference between warning signs and risk factors. Risk factors are events going on in our lives that may put us at a higher risk to either deal with a mental health concern or thoughts of suicide. A warning sign, these are signs that we can see, that we can observe. And sometimes that's hard because we all have different roles and we all wear different hats when we're interacting with people. And if somebody maybe is thinking about suicide, they may only disclose certain things to certain individuals. So sometimes it's hard because we may not know the whole story about what's going on with somebody. So we're going to look at some of these warning signs. But the thing is, we may not see some of these warning signs in people we care about. The important thing is think about the uncomfortable feeling that talking about suicide gives you. It may give you that uncomfortable feeling in the pit of your stomach. The key is that trust your instincts. If you feel concerned about somebody, maybe you don't even know why you feel concerned about somebody, it's okay to check in with someone. If you feel concerned about someone, and we'll talk about this a little later, it's okay to let somebody know you feel concerned about them. Because when you think about the way your body responds to stress, sometimes we feel stress physically before we feel it mentally. And sometimes your body is telling you that you're stressed about something before you even recognize you're stressed about something. So when we're dealing with these warning signs for suicide, and again, warning signs do not 100% mean somebody's going to attempt suicide or die by suicide, even if somebody discloses that they're thinking of killing themselves. That does not mean they're going to kill themselves. We're going to talk about how we gather more information to help us find out if more is going on. But I have certainly worked with clients who have had suicidal ideation, but no intent to act on those suicidal thoughts. But if someone does disclose they're thinking about it, we certainly are going to try to gather more information from them. Especially now with everything kind of being remote online, if we notice somebody we care about posting things that we feel concerned about. I have people that I care about online, and with everything that's going on, they are voicing more of the stress they're experiencing on Facebook more than they ever have before. And if someone's posting something about not knowing what to do, what's the point of keep doing this, things aren't getting better, I usually send a private message just to check in, saying, hey, saw your post. Just want you to know if you need to reach out, I'm right here. I'm more than happy to listen to you for a bit, to work with you in the moment on what's going on. And my one person in particular I'm thinking about, she always responds back, that she's not thinking of suicide or anything like that or hurting herself, that she's feeling stressed. But, just checking in. And when we're dealing with warning signs for suicide, I want you to keep your ears open to how somebody's describing their life, their situation. Are they feeling trapped? They don't know what to do. Are they feeling hopeless? These are the less words. Hopeless, helpless, useless, worthless. Think about it. These are strong words to describe how someone is doing right now or how life is for somebody. If somebody you care about, think of a family member or somebody you're really close to. If somebody you care about described a situation like that, wouldn't you want to know more about what's going on? So what we're talking about today doesn't just apply to suicide. It applies to any mental health concern or just really being there and not just, hearing what somebody's saying or listening. It's both. You're hearing what somebody say, but you're really trying to listen and understand what somebody's saying. And we're going to talk about how we can improve upon those skills. But someone may feel like they're trapped because of that tunnel vision. They can't see what's around them. It's not because they don't want to, but they are in a place right now where they can't see what's going on around them. They can't see people who care about them, resources, people who want them to be here tomorrow. And us trying to ask them what's going on, checking in on them, it may not seem like much, but for somebody who really feels alone, that can really be helpful in the moment to let them know that somebody cares enough to, one, even notice them, but also to ask them what's going on. And certainly, again, I know I talked about substances, but if someone discloses they're using substances more than they have before, that's a warning sign because of impulse control. In regards to alcohol intoxication, again, the data is limited because we can't say it with absolute fact. But it's guesstimated that between 30 and 60% of suicides, intoxication was involved. It just decreases somebody's impulse control. But remember, it suppresses feelings, but those feelings come back. And sometimes they come back stronger because that underlying concern where those feelings were coming from wasn't addressed. Not necessarily taken care of, but just wasn't talked about. If you notice somebody withdrawing from friends and family, that can be hard with things being remote. But maybe somebody who you used to always communicate with, text or chat with, or if you're on Facebook or any of the social media apps, you notice somebody who used to post a lot and isn't posting as much anymore. That doesn't mean necessarily it's a warning sign for suicide, but it may mean that somebody has something going on. And we can always check in. And I don't want you to feel like you have to check in with everybody you know. But if you notice something going on with somebody and you feel concerned enough, it's okay to check in with somebody. Someone may feel annoyed that you're checking in with them. And, I'd rather have somebody feel annoyed with me than me feeling a certain way for not checking in with somebody. It's okay to check in with people that we care about or that we notice something's different, something's going on. And I made a point of clicking on this one last because of mood changes. Mood changes are, I don't want to say a big warning sign. I don't want to put a label in front of it, but it's certainly a warning sign that if I notice somebody having a mood change or a mood swing, I feel concerned. And the reason for that is because a dramatic change in mood can be a warning sign for suicide or something serious that's going on. And when we're talking about a mood swing, I'm talking it both ways. Somebody who's doing really well is now not doing well, but that's also somebody who maybe wasn't doing great and is now doing phenomenal. And the reason that, we can feel concerned about mood swings is that if somebody seems to really be doing okay, and when we talk about dramatic change, we're talking about something that just happens like that. This isn't something gradual. It's something that happens immediately. That can be a warning sign for suicide because somebody has a plan now. They don't feel worried about their future. They don't feel trapped. They know what they're going to do. So if you notice somebody having a change in mood, I don't want you to feel like, oh gosh, this is a suicide warning sign. Somebody may be thinking about suicide. I want you to be curious. I know I've been mentioning checking in on people a lot so far in our discussion here, but when I say check in with people, it's checking in with people, but also being curious. Sometimes, we feel kind of rude for being nosy. If you feel concerned about somebody, you're not being rude. You're checking in on them. You care enough to ask them what's going on. So if I notice somebody having a mood change, I'm curious. Like, this person really wasn't doing well and now they're doing great. What's going on? And it's not that I'm questioning. Some people, can have a mood swing and for a positive effect, but I'm always curious. If someone is doing better, I want to know how. What's going on? And it shows somebody, again, I care, I'm interested, because maybe things changed. I've certainly worked with clients who weren't doing great, but then within a week's time, things are doing great. They got a new job, they're organizing their time better, relationships has improved with friends. But I want to know what's going on. And that's what we want you guys to do. If you notice a mood change in somebody, just ask them what's going on, and letting somebody know why you're concerned. I noticed you didn't seem to be doing so well last week, and now you seem to be doing better. What's going on? And it may not be anything related to suicide, but at least we asked what was going on. So this is where we're going to talk about kind of how we ask about suicide. And I have done trainings the past couple of years on suicide prevention and mental health, and there have been some trainings where I encounter questions asked about suicide that I don't agree with as a mental health professional. When it comes to asking about suicide, we want to be direct. It's uncomfortable. Nobody wants to ask a question about suicide because it is an uncomfortable question, but we want to be direct because I really don't want any miscommunication. I've heard people ask, are you thinking of hurting yourself? If my gut is telling me I feel concerned about suicide, a suicide risk, I use the word suicide when I ask about it. And the reason for that is not to scare somebody, but to let someone know that I'm comfortable enough saying the word. It's okay to talk to me about it. It's letting somebody know that, it's safe to talk to me about it. There's a misconception that asking somebody about suicide or talking about suicide increases the chance of somebody attempting suicide or thinking about suicide. That is false. It decreases the chance because we're talking about it. People do not want to die by suicide. Remember that. They just don't know what else to do. And there's so much stigma, guilt, and shame for maybe having suicidal thoughts or being in a place where someone's thinking about suicide, that someone may not be willing to ask for help unless somebody else starts the conversation. And that's what we're doing by being direct and asking about suicide. And, in my experience, majority of people I've worked with, if they're thinking about suicide, they don't have a plan. But, if I ask them and they say, no, oh, no, I'd never think about that. At least I asked. I was concerned enough to ask somebody. We can also ask people, are they thinking of hurting themselves? And they may say yes, but then, we do want to check in on suicide. Self-harm is not ideal, but it's different than suicide. Self-harm, somebody's still here. Suicide, someone may not be here tomorrow. And that's why I'm a little bit more direct when I ask about suicide. And if someone says no and I'm still concerned, I'll ask about self-harm. But when it comes to suicide, I can be very direct. And I use the word suicide. Are you having thoughts of suicide? Are you talking about suicide? And when we ask these types of questions, it doesn't have to feel like it's coming out of nowhere. Remember, if you care about somebody to the point where you're going to ask about suicide and you feel concerned, let them know why. You can say, well, I feel concerned. You've mentioned that, you didn't know what to do. You mentioned feeling hopeless, feeling trapped. I'm wondering, are you having thoughts about suicide, or are you talking about suicide? You can let somebody know why you're asking the question, that you feel concerned. And I know I've said feel concerned about 2 million times already. And the reason I keep pushing that is because when I talk about feelings, it's a little bit less direct or confronting than saying I am concerned. I feel concerned for somebody. I don't say I'm concerned about somebody. I feel concerned for somebody, because sometimes that's a softer way to ask somebody how they're doing. The key is that we're trying to make our wording as neutral as possible to encourage somebody to be open with us, to feel honest, and to feel safe enough to tell us what's going on. The important thing is that if you're going to ask somebody about suicide, we have to be mentally prepared for the yes. We may not feel like we're ready for the yes, but if we're going to ask about suicide, we have to be somewhat prepared for a yes. Now, in my experience of working with university students, for example, when I first took the position as suicide prevention coordinator, my first thought was, what experience do I have in working with clients with suicidal ideation, or students or individuals with suicidal ideation? Majority of clients I've worked with have disclosed some form of suicidal ideation. That doesn't mean they're suicidal, though. There's a difference between suicidal ideation and someone who's actively suicidal. And the difference is how somebody responds to, are you having thoughts about suicide? Suicidal ideation is, yes, I'm having thoughts. Actively suicidal is, yeah, I'm having thoughts and I'm thinking about acting on them. There is a difference. Both are uncomfortable, but there is a difference. And a suicidal ideation can be thoughts of wanting to kill oneself, but it could also be passing thoughts of, what the heck would it be like if I wasn't here anymore? Or I feel so stressed right now, I just don't want to be here anymore. These all fall within ideation. So there is a difference between somebody having thoughts and somebody willing to act on those thoughts. Someone, if it makes sense, someone who's had additional thoughts about how they would act on those thoughts. So if someone says, yes, I'm thinking about suicide, again, we want to be direct. Do you have a plan? And that is the only question I put, okay, up there. That's the only question I have up there. Do you have a plan? And the reason for that is, again, we want to be direct. I want my questions to be short and to the point. And the reason for that is not because, in general, I'm a counselor. I love questions that help us reflect and explore feelings. But when it comes to suicide, I need information now in order to determine if I have to help keep somebody safe. So if someone discloses to me that they're having thoughts about suicide, usually they let me know before I even ask about a plan, that, I would never do it. I couldn't do that to somebody I care about. But if someone says yes and doesn't provide any more information, I have to ask about a plan. I have to ask, do you have a plan? And then if someone says yes, remember, you're just gathering information. This isn't to minimize what you're doing, but you're gathering information. If someone says, yeah, they have a plan, I want to know the details. How, when, where. And that can be really intimidating, especially with remote work now. If we're doing this online with somebody or doing it through video, that can really be intimidating. And you're gathering this information not because it's now your sole responsibility to keep somebody safe. You're gathering this information because now we're going to get somebody else involved. If you're at Wayne State, you're going to get our counseling center involved. You're going to get the dean of students involved. If you're outside of Wayne State in the community, you're going to get the suicide hotline involved, or even the police involved, because we want to keep somebody safe, even if somebody says they don't want other people to know. Because I would rather lose somebody because I told someone else that someone was thinking about suicide and had a plan than somebody dying by suicide. There are no secrets when it comes to suicide. So if someone is discloses they are having a plan, they do have a plan, or someone even having thoughts about suicide, but they don't want anyone else to know about it, I don't want you to feel like you've hit a wall with someone. We can ask, okay, who else can we tell? Somebody else has to know what's going on. And the key is that you're doing the best you can in that moment to help somebody. I've done these trainings and I've had people ask me, well, I had a friend talk about suicide, and I actually stayed with them for a week. And the question comes up, did I do the right thing? And that's not a yes or no answer. You did the right thing with what you could in that moment. So I don't want you to feel like you're going to do the wrong thing. You're doing the best you can in the moment. But the important thing is that if somebody discloses they're having thoughts and having a plan, it's not just on you. You can always reach out to somebody. And even if someone says they don't have a plan, they're having suicidal thoughts, and you feel, obviously we still feel concerned. If they're at Wayne State, you can always reach out to the counseling center here. And I say the Dean of Students office because we have a care report, and I'll provide that information later in the presentation. But you can always reach out, just because it's never on you, just on you, to help keep somebody safe. If you feel concerned about somebody and you don't know what to do in the community, the suicide hotline is for people who are having suicidal thoughts, but also for people who are concerned about somebody. So I don't want you to ever feel like it's just on you to keep somebody safe, even though it may feel like it because somebody disclosed this just to you. It's never just on you. But when we're talking to somebody,
Chat. Is
uh-oh,
Katrina? Yeah, Katrina asks, is there someone else I can call besides the police for someone who is far away?
that's a good question. So for someone who is far away, um, and I understand it can be tricky with the police. Thank you, Raj, for keeping an eye on the chat for me. It depends. If somebody is disclosing that they have a plan, that they're going to act on that plan, unfortunately, the police may need to be involved. It's not ideal, but to keep somebody safe in that emergency type situation. But if somebody has friends or family that live closer to them that they are willing to reach out to, or even if that person's just willing to check in with you the next day or a week from now, that can help as well. Um, you know, it's not ideal for the police to be involved. Even if somebody lives far away, we can always do safety checks, but unfortunately, it does involve local police in that area. Um, if somebody is willing to, let you know that they're going to check in with people close to them who live closer to them, but if somebody is actively suicidal, if they live far away, um, it may be hard because we're thinking, how the heck do we connect with local police? The suicide hotline can assist in reaching out to local police to check in with somebody. If somebody is actively suicidal, police may have to get involved to keep that person safe. But if someone's talking about suicidal ideation, okay, who else can you reach when you're feeling this way? We are going to talk a little bit about a safety plan later on with this training. And I do realize that this training may end up going over an hour. So I'll keep going, but I'm also going to provide slides in the recording of this too. I hope that kind of answered your question a little bit there. Okay. Um, when we're talking to somebody about suicide, um, this hurts me as a counselor to tell you, I really don't care how you feel. And that's not me being mean. Um, but I care a little bit about how you look, how you present yourself. And the reason for that is that if you appear confident, that can actually help somebody in the moment. Think about it. Time you've been really stressed, and you don't know what to do. I can certainly think of going through the PhD program here at Wayne State, feeling stressed about things, and my advisor was just as cool as they come. And that certainly helped me with my stress. So if we try to appear as confident as we can, And you can let somebody know, like, I don't know what we can do right now in the moment, but let's figure it out. We want somebody to still have a voice in their mental health. We don't blame people for mental health concerns, but we don't let them off the hook on how they're going to get better. So we want someone to feel like they're kind of involved in the decision-making process too. What do you think we need to do right now to keep you safe? And just a reminder about a previous suicide attempt as a risk factor. Think about it. If someone discloses to you that they're having thoughts about suicide, we ask them, about these thoughts, what's going on. But I also am curious. I'm a really nosy person. I want to know if this person has felt like this before. That's how we kind of get information about a previous suicide attempt. Have you ever thought about suicide before? Have you ever attempted before? And you're not being nosy. You care enough to ask somebody what's going on. And when I'm working with clients, and if someone discloses to me that, yeah, they attempted 2 years ago, I want to know what was going on 2 years ago. Not because I'm telling somebody, hey, you got through this 2 years ago, you're going to get through it again. I want to know, how did they get here? I do want to know how they got through it. Because remember, with tunnel vision, someone may not see resources, they may not see people that care about them, but they may also not see what strengths they have that may help them get through what they're feeling right now. Now, when we're talking about keeping somebody safe, we want someone to help us in figuring out, okay, what's going to be our safety contact number? And this can be for somebody who's living far away too. It can be, if I feel like this again, I'm calling the suicide hotline, or I'm texting the crisis text line. Or I'm going to call my mom. I'm going to call my sister, my brother, my friend. The key is we want somebody to come up with these before we start suggesting them. And that's helping us, again, helping someone get out of that tunnel vision, or at least breaking through a little bit. However, if somebody is actively suicidal, they have a plan, they're going to act on it immediately. Or if you feel your safety is in jeopardy, what we're talking about goes on pause. And we need to call in other professionals to help the situation. And that will most likely be law enforcement, to keep somebody safe and to keep you safe. If somebody is actively suicidal, and the reason, we respond quickly is because, think about, somebody already feels alone enough where they're thinking about suicide. We don't want to leave them alone. So when we say leave an actively suicidal person alone, this was usually directed more so when we were seeing people, more in person with people, but also with online too. Letting somebody know, hey, I can stay here with you right now on the phone or through chat. Let's reach out to somebody else too while we're both together to figure out what the heck we can do. I've certainly been with a client, but also on the phone with a hospital about how we can receive this client into the hospital. So it's okay to have somebody else come in too. And that's tricky with remote, but it is possible. If you're chatting with somebody or having us chatting with somebody online or whatnot, or doing a video call with somebody, to call out for somebody else too, to find out what the heck's going on. Or it could be, let's call the suicide hotline and let's see what they say we should do right now to keep you safe. No matter how you feel about suicide, keep that to yourself. Remember, there's so much guilt and shame already with suicide. We don't need to add anything more to it. Now, we've talked a little bit, I mentioned listening and hearing, but I want you to think about, when you're talking to somebody, how do you know someone's really listening to you? How do you know they're engaged in the conversation? That's how we want to be with people. And with remote, we can still show that we're listening to somebody. And, if we...
Goddamn. document.
Oh. Is somebody else got a mic on? Okay. So when we're dealing
in the chat, if that's okay.
Okay.
Yep. Jenny asked, "Is there a way I can share this webinar with my family? We have 3 high-risk individuals in my family."
Yeah, we're going to be, this is recording right now, and these slides will be made available after the presentation. We're going to have available on the Campus Health website, as well as the suicide prevention website. So yeah, these will be made available. Yep. So when we're listening to somebody, we follow these 3 attitudes. You know, we accept people for where they're at. Doesn't mean we agree with them, but we accept them. And that's the same with us. We may not feel like we're doing the best right now, or may not, feel like we're doing what's best for us right now, but we accept us where we are right now. And that's part of being genuine too. It's being your genuine self. I don't want you to feel like you're following a script when you're, letting somebody know you care about them. Even if you mess up, that's you being genuine. And empathy is different from sympathy. Sympathy is feeling sorry for someone. Empathy, yeah, we do feel sorry for how someone's doing, but it moves past that. It's free, but then trying to understand what it's like for that person to be going through what they're going through. And how we show empathy, how we communicate empathy, is asking somebody how they're doing. Oh, shoot. Damn it.
Steph, is everything all good? Hello?
All right, can everybody hear me? Yeah?
Yep.
Okay.
Yep, we hear you.
Okay. Lost power there for a second. The joys of remote work, right, guys? So let me, for some reason, can anyone still see my PowerPoint? Yeah?
Yes.
Yep.
Okay. Okay, because I can't see it anymore. So let's figure this out here.
I can see it.
Everybody can see it but me. Okay. That's okay. We'll work through it. All right. Let me try something. Back. I appreciate you guys being patient with us working through all. Let's try this again. I don't know why I'm paying so much for Comcast for it to always be acting up, but that's all we got out where I'm at. Okay, let's see here. We're gonna reshare it, guys. Appreciate you guys staying with me. For those who can only stay for an hour, this will be made available for you after the presentation. Okay, so let me just bring this back up. All right.
Thanks, Steph. I gotta get back to work.
Yeah, I appreciate you guys. Yep. Everyone take care. For those who want to stay on, I'll go through the rest, but don't worry, we will make this available for everybody, okay? Including the recording, but also the slides too, if you want to have them. All right. I am resharing here. Okay. I think we are going. Okay. All right. Let me go here. Okay. When we talk about giving reassurance and information, we are talking about letting somebody know that we hear them and that we're going to do what we can right now in the moment to help somebody. Think about, again, a time you were really stressed, you felt really stressed. What helped you in that moment? Maybe it was someone letting you know, hey, things aren't okay right now, but we're going to do the best we can with what's going on right now. We want to try to help instill that hope in somebody. We don't know when they're going to feel better, but we know that eventually they will feel better. There's no timeline to somebody getting better or feeling better. And information that can be resources, letting somebody know there's no shame in having a mental health concern, that you really appreciate them, letting you know what they're going through, or even acknowledging that it's hard to talk about mental health. Even though we've done what we can to reduce stigma, it is still there. So just acknowledging, letting somebody know that you really appreciate it. It could also be letting somebody know that there's no shame in talking to a mental health professional. I'm a little biased. I think everybody should be in counseling at some point in their lives. But there's no, you can let somebody know it's okay to talk to a mental health professional too. They're there. They're trained to listen. They're trained to help you. But just, having that honest conversation with somebody. And then when we talk about appropriate professional help, when we're talking about mental health, we're talking about people who've had mental health training, but somebody may also need to check in with their doctor, because with mental health and physical health, one is not greater than the other. They intertwine with each other. And certainly our physical health can affect mental health, and mental health can affect physical health. But we're also looking at psychiatrists, social workers, counselors, psychologists, peer specialists, people who've had additional training to talk to somebody. When we talk about professional help, we're talking talk therapy, which is what I call counseling. Maybe we're talking about support groups, counseling groups. And with medication, there's a lot of stigma attached to medication for mental health. There's no shame in taking medication for a mental health concern. There are some things that we can't address in talk therapy, like a chemical imbalance. Medication can. The best bet for somebody to recovery, whatever recovery looks like for somebody, is if they are taking medication, is for them to also have therapy as well. That way we're covering all sources of what could be going on with somebody's mental health. But sometimes with insurance and money and resources, someone may only be able to do medication, and that's fine too. But usually the best option is to have both if someone is taking medication.
In the chat. So
Sure.
Jen asked, what if you feel like the advice given by the suicide hotline is dismissive or follows a script? And if the initial steps make the person feel worse or not want to continue, especially as resources are stretched thin during the COVID-19, like therapy appointments, etc.
Yeah, that's a good question. And unfortunately, some of those hotlines, people are following a script. If somebody feels like, maybe the suggestions from the hotline aren't going to be helpful, it's having that conversation of what's going to be helpful for that person. Because when we talk about, and I'm going to clip to this slide just so we have it up there, and then we're going to talk a little more. But if someone feels that the hotline wasn't helpful or dismissive, which is unfortunate, but there are certainly, every field out there, there are people who maybe need to go back for training or aren't aware of how they affect other people. The important thing is for us in our roles to let somebody know that this isn't the only option, that, let's figure out something else that can be helpful. With some of my clients, what we do is if they're talking about suicidal ideation, but also self-harm, we actually look at phone apps to help somebody in the moment. But if a hotline doesn't seem to be effective, that's when we start looking at what are community mental health resources available for somebody. A lot of counseling centers are doing remote work. I do sessions with clients through Teams, tech issues and all. But it may be time to try to find individual therapy for somebody or a support group. And even with things being remote, I do video sessions with clients. I do phone sessions with clients. because, the hotline, there are mental professionals that run it. But sometimes having that individual one-on-one therapy can provide a better experience for somebody, to let somebody know they're really feeling heard. Because I would hope that a counselor in session isn't following a script with a client. But there are free resources out there. I can speak the Metro Detroit area. There are free counseling sessions out. Counselors understand that finances are hard, and they do sessions on a sliding scale, and it's based on how much income somebody has or how much money they have coming in. That way everyone can afford counseling. But here at Wayne State, we do have a counseling center for students, but we also have a counseling center for community, and it's entirely free. And they're doing remote sessions. But if somebody is in a different state, that's where it gets tricky. And it's just trying to, this isn't to dismiss it, but services in the area to see what their policies are. If a hotline isn't working, that doesn't mean that that's the only option somebody has. It's trying to get creative to figure out, okay, what else can we do to have somebody be able to talk to someone, to listen to them. And with counseling, it's usually once a week, sometimes more, if somebody needs it. And that's the thing when it comes to trying to help somebody. It's not a one size fits all. Sometimes sometimes we're working with somebody, I say working, but we're with somebody we care about, and they may be going through something that we went through, something similar, and how we got through it doesn't mean that's how that person's going to get through it. I don't know about you guys, but relaxation, meditation doesn't work for me sometimes because I'm too active. It's hard to get me to sit still. I'm really trying right now to sit still. But exercise, yeah, that's my thing. But the important thing is having that other person have a voice in what they're going to do next. What do you think is going to help you right now? And we can suggest things, but there's more value. There's more value in somebody I think they can do, because then it's something that they're invested in more so than us telling them, or suggesting. And when people suggest things, they're coming from a good place. Necessarily work for you. And when we're talking about self-help and
I have another question in chat. Okay.
All right, guys, I am back and hopefully will not click out again. But if you guys can see my slides, that's fine. I can't see them again. I am taking a look at some of the chat that's going on for resources of people with maybe cognitive issues or disorders. I would recommend more of a psych clinic. Thank you, Dana, appreciate it. Letting me know. You guys can see my slides, which is really interesting because I can't see them. But my next thing, what I was going to talk about is just that when it comes to self-care or, just in general, our wellness, it's not just one segment of our health. We're talking mental, physical, emotional, even professional, spiritual. It's not just one section. And, sometimes when we think about self-care, people tend to think of maybe exercise or journaling or reading. And the important thing to ask somebody is, what does that do for them? how does that help them in the moment? We're not asking these questions to be confrontive with somebody, but to get somebody to think about, well, it helps me relax or it helps me calm down. And then we can start thinking about, okay, what are some other things that can maybe help get that same effect for you? Because the important thing is that we do not want somebody to rely on just one tool, because eventually that tool will no longer work. And we want to make sure somebody has other options available to them. Now, what I'm going to do, let me see if the reason, there we go. That's probably why. Okay. There, that's why. The window took up most of my time. Took up most of my screen. That's why I couldn't see it. So we want to remember that when we're looking at somebody taking care of themselves, some people may be really good at taking care of one aspect of their life, but maybe the other ones aren't being given as much attention. And this is something for us to think about for ourselves too. If we are, we want to make sure we're in a good place too to help others. And then before I cut out again, you guys will have access to these slides. For Wayne State students, our counseling center is the #1 spot for mental health services and mental health information. And that's the same for faculty and staff. If you're ever concerned about a student, I would encourage you to reach out to CAPS and also to file a care report with the Dean of Students office, because if you file a care report, it's anonymous. The student will not know you filed the report, but Dean of Students office can connect to CAPS too, in case we need to check in with a student. And CAPS is available during the day, but also if something's going on after hours, a mental health concern or a crisis, that's what our after hours number is there for. The Mental Health and Wellness Clinic within the College of Ed, this is a free counseling resource. This is where our graduate counseling students complete their clinicals. We also have a psych clinic at Wayne State that works with the whole community as well. They're free for students, and then they charge on a sliding scale for the community. So it's fairly inexpensive therapy as well. Sometimes students just need to chat with another peer, and Warrior Chat is there. They're not counseling or anything like that, but if a student just needs to chat with another peer about feeling stressed, that's certainly available for them too. And these resource information, the resource information here, that's also listed on our website too, but you guys will have access to all this after the presentation. Just some other resource information, because you may encounter students who need these resources. They just don't know how to get them. Anything related to the health center, even student disability services, Title IX. Some students may talk about procrastination, not being able to manage their time, maybe having trouble with a subject. The Academic Success Center is doing remote workshops as well. And sometimes students, they want to get involved, but they don't know how. And virtual Get Involved. Our clubs are doing online activities as well, even with everything that's going on. Now, the College of Ed Mental Wellness Clinic is a community resource, but this is another one that was recently launched in response to the COVID pandemic. If somebody needs to talk to somebody, this hotline has just been developed for the state of Michigan. There is another one that's in the works, but I haven't heard of any recent developments on it, just that they have enough counselors volunteer to run it. And so this other hotline will be done by limited license and fully licensed counselors. This hotline is peer support specialists who have had some mental health training and are kind of there to help work with somebody in the moment and kind of help empower them to continue to push forward with all the stress someone may be experiencing. And then last but not least, I know I've talked about the suicide hotline a lot. The suicide hotline will eventually, hopefully, be changed to a 3-digit phone number. That is not official yet, so we still recommend the suicide hotline. 988 is not official. It's not officially set up yet. Eventually it will, though. But 1-800-273-TALK, that's the National Suicide Hotline. And even if something's happening across state lines, they can help. With mental health professionals, anything across state lines can get tricky, because most mental health professionals, their liability insurance only covers the state that they're practicing in. But hotlines are able to assist across state lines. The crisis text line, if somebody doesn't feel like talking, they can always text 741-741 to reach somebody. And I know I went through these kind of fast at the end, but that was just so internet did not continue to act up. I appreciate you guys staying with me past the hour. In my experience, usually suicide prevention trainings go past the hour because there's a lot to talk about. But I am actually still available. Actually, I'm going to end our recording, and then let me see here. Stop the recording. Yes.